2 in 3 of us at some point in our lives will experience a mental health difficulty. Now, that's pretty severe, and that says a lot about the frequency of mental health issues in our society today, the prevalence of mental health issues in our society, and also the likelihood of you either experiencing or encountering somebody who is experiencing a mental health difficulty. Therefore, it's probably pretty good if we can equip ourselves with how to actually speak to and help people around us that are experiencing mental health difficulties. But exactly how do we do that? How do you speak to somebody, and what should you do with somebody who is experiencing mental health issues? Well, on this week's episode of GetPsyched, we're going to take a look at just that. So the first question we have to ask is, how do you actually know if somebody is experiencing a mental health difficulty or not? Well, the first thing that you've got to think about is not to get too worried about diagnosis. First of all, the likelihood is you're not a doctor, you're not a psychologist, you're not a therapist, and you don't have to be on the initial stages. Don't worry about starting to diagnose somebody with anxiety or depression or obsessive compulsive disorder. That's not where we start. That's not your job either. If you're encountering somebody that you think might have a mental health difficulty, you don't need to worry about a diagnosis. Some of the things that you do need to consider, though, are perhaps changes in that person's presentation. These are some of the ways in which we can start to understand if somebody is experiencing a mental health difficulty or not. Things like, are they different in social situations? Have they started to isolate themselves a little bit? What are their relationships like? Their friendships, relationships with their partner or family members. Maybe you come into one of those categories for that individual. Have they started to distance themselves a little bit? Have they started to reserve themselves or become quieter perhaps in social situations? These are some of the little subtle telltales that we can take that maybe infer that somebody is experiencing a bit of a mental health difficulty. One of the other key things to keep in mind is when somebody is evidently not enjoying situations where they used to enjoy. So for example, if you and a friend love going and playing football with one another, and you're enjoying it, your friend's enjoying it, but all of a sudden your friend has started to seem to not enjoy it as much. That doesn't necessarily say definitely experiencing a mental health difficulty, but it's maybe giving you a little bit of evidence that something might be off. So that's some of the ways in which we can tell a little bit about if somebody is actually experiencing a mental health difficulty or not, and therefore gives you the door in or the step in to actually being able to help that person. But why is it so important that people start to learn how to talk to people that are maybe experiencing mental health difficulties and actually can help a little bit? Well, it's important for a number of different reasons. First of all, as we said at the very start of this video, there's a huge increase in mental health difficulties in our society today. The likelihood is that either you or someone you know is going to experience a mental health difficulty at some point in their lives. And so it's really important, at least in my opinion, and I'm sure you agree, that people in society start to equip themselves with actually how to speak to people that are experiencing mental health difficulties, being able to identify mental health difficulties, which we've just looked at, and also being able to refer on and suggest professional help for people that might be experiencing mental health difficulties. This actually, in some ways, is already starting. There's something, at least in the United Kingdom, called mental health first aid, and it's very much as it sounds. First aid is something that many people get trained in to be able to help people that are either choking or experiencing some kind of physical health issue very immediately. They can go on the front line and help, then call a paramedic and then get an ambulance, and they can help that person in that way. Mental health first aid training is kind of similar. It's training in being able to speak to people about mental health difficulties and actually being able to assist them best. But one of the issues with it is that it's primarily reserved for professional training. This is not necessarily something that the general public are accessing, although they have the ability to. Mental health first aid is not something that the general public are accessing enough. So we need content like this, videos like this, to help the general public understand a little bit more about how to actually speak to people with a mental health difficulty. So what are some of the things that you need to say and do for somebody that you may think is experiencing a mental health difficulty? Well, the very first thing that you have to do is you have to be a listenable person. Now, what do I mean by that? Fundamentally, I mean you have to be the kind of person that is able to listen to people. Somebody is going to want to talk to you because they know that you're going to be somebody that will listen. So listening is so important. In today's day and age, what we try and do is we try and fix people's problems. That's the opposite of what we need to be doing when we're speaking to somebody about a potential mental health difficulty that they're maybe facing. Don't try and fix a situation for somebody. Don't tell them what to do. Don't tell them what you've done that's helped you. Sit there in the initial stages and just let that person speak to you. The other thing I would say here is to set aside time to have that conversation. Don't just burst out with that conversation. Perhaps you're at a party, perhaps you're out with some friends or something like that. One of the last things you want to do is to put that person on the spot and make them feel uncertain or insecure. Set some time aside, maybe text a friend after a social event where you've noticed some of the things that we spoke about earlier that maybe identify a potential mental health difficulty. Text that friend later on and say, hey, do you want to catch up for a drink, catch up for a coffee? I just want to check that you're okay. You perhaps seemed a little bit off tonight. Those kind of things are absolutely appropriate. If it's on a one-to-one basis and that friend trusts you, then set aside time and give that friend the opportunity to speak on the level that they want to speak, and let yourself listen to what they want to say. Like I said earlier, let them lead the way. Don't direct somebody into thinking, oh, you've got depression, or oh, you've got anxiety, or anything to that effect. You don't need to be diagnosing anybody. That's not your job right here and right now. You think about a physical health issue. You think about somebody choking at a restaurant. You might need to know some basic physical first aid things. It's not your job, nor should it be your job, to save that person's life, to conduct an operation in the restaurant there and then. It's very much the same with mental health. It's not your job to fix that person. It's not your job to cure that person. What your job is to do in that moment is to listen to that person, to not judge them, to not try and diagnose them, and to give them an opportunity to speak. The other thing in an environment like that, when you're speaking to somebody about a mental health difficulty that you think they might be facing, is to not go off and tell other people about it. One of the key things when you're kind of starting out in the initial stages of talking to somebody about mental health difficulties is to establish a real relationship of trust. One of the best ways to break that trust is to go off and tell other people. It's the same with therapy. Me as a therapist, as a counselling psychologist in training currently, I have a really strict program of confidentiality. Now, I have that in order to protect my clients, and I have that also to establish that boundary of trust, to ensure that relationship of trust is continually there. Now, of course, it's my job to break that confidentiality if I ever think there's some suicidal or self-harm issues going on there, but that's my job. Your job on the front line is to establish that relationship of trust. Let the person speak. Okay, so we've looked a little bit at how you can tell if somebody is experiencing a mental health difficulty or not, and some of the things that you maybe need to say and do to help that person, especially in the initial stages. But one of the keys here is to know your limits. So when should you know to go to professional help or seek outside advice and take that step beyond just speaking to you as a friend? Well, like I said, one of the key things to do is actually offer or suggest your friend seeking therapy or going and speaking to their GP. This is especially the case when you start to think that maybe you're reaching the limits of your competency, and that's something really important to keep in mind when you're best supporting a friend or loved one who might be experiencing a mental health difficulties. You need to know the limits of your competency, and you need to be able to suggest, actually, do you know what, maybe it's best that you go and see a therapist, or I really think you should go and speak to your GP about this, and they'll be able to support you. We live in a society today where therapy, mental health, going and speaking to your GP about mental health is still stigmatized. One of the best ways to reduce that stigma is to allow yourself to talk about it. So if you actually suggest it, your friend might be a little bit nervous to suggest that. If you can suggest it, you're breaking down that stigma and you're increasing the opportunities and the acceptability of your friend or loved one to actually go and speak to a therapist or a GP. I don't think it would be appropriate for me to not talk about this in this video. I think it's really important that we talk about suicide and self-harm, suicidal ideations as well, and I think that's something that we need to keep in mind here. One of the things that happens when people are a little bit nervous about speaking to people about mental health is they don't know where they're going to get. Now, if you have identified some of those subtle signs in somebody that maybe suggests that they're experiencing a mental health difficulty, and if you've also taken on some of these steps and tips on actually how to speak to somebody about mental health and what you should be doing, you've got to keep in mind that perhaps your friend or your loved one is experiencing a more severe mental health difficulty. They might open up to you a little bit if you've allowed yourself to be listened to, if you've let that person speak. They might feel comfortable enough in opening up that, you know what, I've had some suicidal ideations, I've had some suicidal thoughts, or I've had some self-harm thoughts. What do you do there? Well, once again, you need to know the limits of your competency. It's really hard to hear this, but it's important that you understand that it's not your job to save somebody's life, nor should it be. It's important that you know the limits of what you can do, and you need to be consistently suggesting that that person goes and sees a therapist and goes and sees a GP. It can do wonders for people to just have a person and have a space that they can feel comfortable in speaking about how they feel. And you'll be really surprised in how you can provide that environment and how that can be hugely beneficial to anybody experiencing a mental health difficulty and anybody experiencing suicidal ideation. So if you've got to this point, you've already done a great job, but it's part of your job now as well to perhaps suggest therapeutic interventions and also going and seeing a GP. Some of the other things that you should be thinking about if you think that your friend or loved one is experiencing some suicidal thoughts or ideations is to consistently check in on that person. Drop them a text, meet up, call, check that they're okay. Once again, it's not your job to save them, to fix them, but it is your job maybe to just be there and let them know that somebody cares. You can say that to them as well. Tell them that you care about them. One of the things that happens with people who are experiencing suicidal ideations is that they feel very alone and very isolated. And if you can remedy that by just being a good friend, by being there, then that's going to work wonders for that individual. So make sure that you check in with them, let them know that you're regularly there, that you can be there to be spoken to, that you'll listen, and that'll have a really great impact for anybody that's maybe experiencing mental health difficulties or even suicidal ideations. But remember, one of the keys to this is to ensure that you're suggesting on a regular basis that that person goes and sees a therapist and goes and sees their GP. Okay guys, thanks so much for watching this week's episode of GetPsyched. This week we've been taking a look at how to speak to somebody who might be experiencing a mental health difficulty. We've looked at some of the key signs, some of the subtle signs that you can tell if somebody is experiencing mental health difficulty or not, and also some of the things that you can say and do, and ensuring that you're knowing the limits of your competency in order to help that person best. If you've enjoyed today's video, then you're definitely going to enjoy this video here on how you know if you've got depression. Make sure to check that video out. You can click it here. And if you've been enjoying GetPsyched as a whole, you can subscribe to the channel and you can hit that little bell next to the subscribe button and you'll get weekly reminders every time I upload. Thanks so much for watching again, guys, and hopefully catch you next week.